So with the last week's release of the global TB numbers, the figures show that less than a third of estimated MDR patients are diagnosed worldwide, and only a fifth of those receive treatment. And it also shows that the treatment gap that they showed last year is increasing. And we've got to also realise that the treatment gap that they've highlighted this year, and that is patients who've been diagnosed but not started on treatment, is only added to the patients last year that were diagnosed and not started on treatment. And this is similar to what we are finding, and there's showing that the MDR epidemic, and the other figures in the report was that the MDR epidemic in some regions of the world is growing such that it's no longer just patients who've had treatment before who are getting MDR, but it's patients who've never had TB before, and their first diagnosis is of MDR TB. And at MSF, we are experiencing at first hand the reality of what these numbers on paper mean. And we are seeing that the cases of DRTB are growing. We are seeing that the disease is spreading independently now. It is becoming an epidemic. In some regions, it is becoming an epidemic in its own right. With that in mind, we wanted to review and highlight what is actually happening on the ground. We have global numbers, we have global policies, but what is the reality in the countries with the burden and their challenges? So MSF produced the Out of Step report in order to take a candid look at the TB response on the ground. And with the advent of new tools, so we know there's a new diagnostic test, Gene Expert. How is that being used? How is it being implemented? We also know that there's new drugs that have come in the last sort of 18 months. How are they being used? Are they getting to the people who need them? We know that there are plans for new regimens, and we need to look to see if we're able to implement the recent developments in a speedy way, because that has a direct effect with other new developments. How fast are they going to get to the people who need them the most? So in this report, the Out of Step report, we surveyed 8 countries, Brazil, India, Kenya, Myanmar, the Russian Federation, South Africa, Uzbekistan and Zimbabwe. These countries, MSF has TB projects in all of these countries apart from Brazil. These countries represent a range of incomes, a range of disease burdens, and so we hope that while the results are for these countries with the breadth of the countries, it can be a marker of what other countries with similar economic status and burdens may be experiencing. So we surveyed 30 TB indicators and looked to see where the gaps were, and we found deadly gaps in every aspect of their DRTB response. There were gaps in access to treatment, there were gaps in access to diagnosis, there were gaps in what treatment models were being used, how they were implementing current WHO guidelines, how they were using new information about decentralization of care, patient-centered models of care to improve their MDR response. There were gaps in access to the drugs, both existing drugs and the new drugs, and then as well, probably most a key part of the DRTB response in countries is the funding gap. And that all countries had some funding gap in how they're able to support and pay for their DRTB response. I think what we want to try and I hope you've gained is that this is an emergency. We are talking numbers, we are showing graphs, but on the ground, treating patients, this is an emergency. We have patients, in some hotspots, MDR-TB is the normal TB. It's not only 3.5. That's the normal TB. XDR-TB is becoming the new MDR. We do not have, due to problems with R&D, we're barely able to cope with the MDR epidemic. We are not going to be able to cope with the XDR. We need to inject a real sense of urgency into our response. We need to stop talking the numbers and start actually doing something to stop the problem and change the epidemic. Turn it around, stop it, because otherwise we are building up enormous problems for the future when we have an opportunity with new diagnostics, new drugs to actually do something, and we are not. So with that sense of urgency, there's stuff that we can do. We don't need to wait for a new regimen. We want that, but countries what Out of Step is showing is that we're not even doing the right things properly now. So countries, you need to look at your guidelines and ensure that you have got the right treatment for your epidemic. The removal of category 2, if you're in which is a retreatment regimen that in areas of high MDR is unlikely to work. Stop wasting money on that and invest in the right treatment. Also, as Petros says, we have a new diagnostic test, but we're kind of a bit late on that even in some of the hotspots that we need to look for the full drug sensitivity package. Yes, we need expert. We need expert scaled up, but we need the backup of a proper lab system behind that. And that's something that we can do now. And to do that, donors need to be aware of the problem and step up and fund a bold response to the problem. I think we have to realize that globally, both countries, donors, everyone, a TB problem anywhere is a TB problem everywhere. We can't ignore it. It's going to come back and bite us if we do. And manufacturers have a part to play in this. As Phil says, we have 2 new drugs. That one of them has been available for nearly 2 years now, and it has not been used outside compassionate use programs. We have new guidelines on the laminid, the other new drug that were released on Wednesday. That drug now needs to get to patients, and that involves everyone coming behind that. That involves the manufacturers ensuring that their drug is affordable and accessible. It needs to be registered in countries, and it needs to be affordable in part of the regimen. So it's not just the drug itself, it's been added to a regimen with at least 4 or 5 other drugs that are also, those costs need to be borne in mind. Countries need to ensure that they are ready to fast-track registration of this new drug and fight for it. If the manufacturers aren't willing to bring it to their country, demand that they do. That's what countries can do. And donors need to pay for it. They need to understand that it is vital that we step up our treatment to ensure that we turn the epidemic around now, because otherwise we will be paying tenfold in a couple of years' time. And finally, that's what needs to be done now. Also, we need to look at our regimen, as Phil said. It's 2 years, it's long, it's toxic, it's got old drugs. We have 2 new drugs, but we don't know how to combine them, and they as yet haven't been put into a new, better, shorter, more tolerable regimen. And one of the reasons behind that is that the TB R&D system is broken. The TAG TB R&D report that was also released last week shows that TB funding for R&D is going down. Pharmaceutical involvement in TB R&D, they are withdrawing. We've had 3 large pharmaceutical manufacturers in the last 2 years completely withdraw from the anti-infective arena, which is TB. And we need to get them back. We need to incentivize them, and we need to look at how to get the funding back in, but also how to ensure that, as well as getting new drugs, that one drug does not cure TB. It is a regimen that cures TB. We need to make sure our R&D is set up to answer the public health need that we see on the field. And with that in mind, MSF with partners has been working on a novel and innovative idea to reinvigorate and ensure that TB R&D answers the current problem and is ready and equipped to deal with the future problems. And we are having a symposium on our 3P proposal, which is this push-pull-pull proposal. We're having a symposium on that on Friday afternoon. I would really like it if everyone could attend to join in the conversation about how we deal with the epidemic in the future, but we also need to deal with it now. Thank you.